Greetings, everyone. I'm Burlington Mayor Marianne Mead Ward, and I would like to welcome you to another edition of Burlington Matters, where we assemble local leaders and community advocates and residents here in the city of Burlington to talk about what's on our mind and hopefully leave you inspired and informed. And today's show is going to be a good one, as they all are. We are going to talk about the pandemic and emergency response, what we've learned now that we can look back and see it in our rearview mirror a little bit, and what the future holds. So I'm delighted to be joined today by Karen Roach, who's the chief of the Burlington Fire Department, and Amber Rushton, who is our community emergency management lead, also working through the city of Burlington Fire Department. So welcome to you both. And let's get right into it. I'm going to start with you, Amber, to talk to us a little bit about your role. What is a community emergency management person do, and why do all emergencies go through the fire department? I think that's a really important, because we weren't on fire here in Burlington. It was a health crisis, but nevertheless, our fire department is still the lead on emergency response. So a little bit about that, and then I'll come to Karen. Go ahead, Amber.
Yeah, sure. Thanks for that, Mayor, and thanks for kicking it off with such a loaded question here. I think it kicks us off with some good dialogue. To start, the emergency management coordinator truly helps prepare for any type of emergency across the municipality. When any emergency, much like the pandemic, hits, my role is to manage our emergency response, to activate our corporate emergency response plan, and to oversee all of the logistics and the operations throughout the emergency, in a nutshell. In terms of why it resides under fire, it truly does depend on the municipality. In Burlington, I believe we're very proactive in the fire service, in that we take an all hazards risk management approach. And that's where my position truly resides within the fire service. We don't just respond to fires, we do also respond to all types of hazard events, whether it be flooding events or infectious diseases. It could be any active threat incidents, things like that. So, to pair it with emergency services and to work alongside our Halton regional partners truly gives us more of that all hazards lens and that whole of community emergency response.
That's great. And certainly we have learned that it is an all hands on deck. It was an all hands on deck situation in a way that I think no other emergency, certainly in my lifetime and probably yours, has ever been. It's not an isolated incident, and it just cuts across every department and business and community group. And it really did require all of us to come together. Coming to you, Karen. So cast your mind back to day one of state of emergency declaration. I still remember that, March 23rd, 2020. It was a Saturday, and our first emergency meeting at that time was 8 hours long, I believe. We got more efficient for sure. But actually you were involved, and the fire department was involved even prior to that event. So talk to us about sort of what that early warning system was, and what you did initially as soon as you realized that this was going to be an issue for us.
That's a really good question. I think that in terms of the fire service, we're out in the community all the time. So when we were starting to hear a lot of information coming forward in regards to the pandemic, it certainly for us, it meant that we needed to really look at the things that we were doing to make sure that we were equipping ourselves with the right PPE in order not only to protect ourselves, but to protect the people that we're serving in the community. So it was very important early on to make sure that our medical practices that we were doing and providing patient care was bang on. So we didn't know what we didn't know early on, And it certainly was, it was kind of frightening at first, but we tried to maintain business as usual. We did not at any point in time reduce our calls or not respond to calls. We just adapted and overcame what it was that we needed to overcome, lockstep with our rest of our municipalities around us. We were all looking to see who was doing what, and trying to learn more all at the same time. So there was no perfect answer. We just took the information that we had at that point in time, and we tried to pivot and do our level best to make sure that we were maintaining that level of service delivery for our community.
Well, and that, I think we didn't know what we didn't know is it was really key, and that and having to pivot and change constantly as new information came in, as we learned more about how to keep the community safe. And certainly we did that throughout the 2 years. I mean, our response day one was a world away from the response 2 years in. So I want to come to you, Amber, and talk about the structure of emergency planning. There's different emergency levels. There's different groups that come together. We had the crisis management team. We had the emergency control group. Tell our viewers what all of those acronyms that we use for them now, what that all means, and what the escalation was, both up to respond to the most acute parts of the crisis, and then back down when it started to recede a little bit.
Yeah, sure. So initially, I think like every municipality, we had to be quite reactive right out the gate. We had to pull the team together. We activated our rapid intervention team. We kind of formed right away so that all of the key stakeholders could come to the table, maintain that situational awareness, and come up with some very quick responses. If you recall correctly, I believe when this first hit, we had to come together to talk about the teen tour band. They were getting ready to
Oh
go
yeah.
on tour, and that was a very important decision, in terms of health and safety and ensuring we were making the right call. And I think, looking back, it was the right decision that we made. But it was there was a lot of dialogue that was had. There was a lot of pros and cons we needed to work through, and it was that was the first big decision that we took on. And then, all the impacts kind of escalated from there, and we knew at that point, this was growing rapidly. It was a dynamic situation. It was continuously evolving, and we had to continue to respond and adapt and, overcome the obstacles that were in front of us on a daily basis. So as a team, we quickly escalated to our partial activation, which is our level 2 activation. If there are broader service impacts across the community, in terms of impacts from, an ongoing crisis or an emergency, and if there are continual service disruptions at hand, we do activate to our partial activation, and we pull together, what you called earlier was our CMT. That's our crisis management team for all of our viewers. And that encompasses, key stakeholders across the city that come together, and, we activate our crisis, management team, our crisis and information management plan, along with our corporate emergency response plan. From there, it continued to escalate, as everybody knows, but we were able to pivot into more of a proactive stance, I'll say. And that's where we truly recognize that all of our protocols up until that point were really based on coming together in person as a community to respond and bring together, the key stakeholders engaged with the emergency control group for our full activation. So at that point, we had to step back as leaders and say, how can we keep ourselves safe, continuously respond under our emergency response model, but proactively also implement measures to protect the staff and our community? So we came together, and like you said, originally it was about an 8-hour meeting. We ended up brainstorming collectively. We came up with more of a hybrid model that would ensure that we were still in compliance with the Office of the Fire Marshal and Emergency Management. We were still operating under our incident management system structure, but we were also able to adapt and implement those safety measures, protecting ourselves so we could respond effectively to the community and the dynamic nature of the pandemic, and also continue to implement those safety measures for staff.
It was a lot of work at that time, just setting the foundation. I mean, all of the plans and the policies were there. I remember approving. Actually, it was very recent, before the pandemic hit. We just updated our emergency management, and I remember back to those discussions, thinking, it's good to have, but we'll never need that, because
Yes.
you're an optimist, right? So you read through it, all sounds great, approve it, and then very shortly after that, having to follow it and implement it and really test the plan, which I'm thankful and grateful to say the plan was good, and still then and now. And but yeah, we didn't think we'd be putting it into action so soon and for so long. It was 2 years less a day emergency here in the city of Burlington and many other places as well. So Karen, coming to you now, we did touch a little bit on the fact that day one of the emergency looked very different than, sort of the tail end, including the most recent sort of wave and restrictions, Omicron earlier this year even. What was the difference, and what did we learn and change from that early days of the pandemic toward facing that last wave? And even now, I mean, obviously the virus is still with us. We're still having to keep people safe, our staff, our customers, and our community. What have we learned? What's changed?
I think what we've learned is that I hate to use the word new normal, but it is like a new normal. Mask wearing is like a new normal, both indoors and outdoors. And this is still what I would consider a key prevention strategy, because it acts as a barrier of protection that can keep respiratory droplets from spreading. So this is the type of thing, whereas you wouldn't necessarily put a mask on before when you were providing care, you would at that time, but now you're wearing this PPE as you're going in the door and in the truck and in the station and everything leading up to that moment. So certainly those types of practices are more in place. The one thing that we've also learned is vaccines are a powerful tool for preventing disease. So in fire in the city of Burlington, we went mandatory for vaccinations, a decision that was well supported, not only by by our fire management and the city management, but as well as by the local firefighters association. They were very supportive of it, because at the end of the day, it's about protecting and doing all the things that we should be doing to protect our staff. So the other thing is mental health is just as important as physical health. So what we've seen is that, during the entire pandemic, people are juggling working from home, working in a hybrid situation, childcare, isolation, parents isolated, dealing with illness in your home, very, very wide range of different things, and even experiencing loss during COVID. I always feel so bad about the people that could not be with loved ones during those times when isolation was so around in long-term care facilities. There was just that disconnect was really heartbreaking. I think, for us, community is essential, and we still manage to partner with a lot of our community partners, like the Gift of Giving Back, food banks. It really identified a need in our community for those that had less than us, and getting out there and making sure that we were able to bring in non-perishable foods and helping and be a presence out in the community, assisting these organizations, I think was very well received. because there was a lot of people that needed some help and some guidance. And you know, it's sends a huge message to the community when you see these things still happening and happening even more so. So it really does. It does really give a whole other message, which is a good positive message. And the last thing I was just going to say is that with all the things changing, the news and the forecast, maintaining public trust is a huge ongoing issue. It can be difficult because during the pandemic, you know, decisions are made in the moment, and in that
Absolutely.
moment, it impacts thousands of lives. So being able to navigate those rules and guidelines requires the trust of the members of the public, but it's run a little thin probably over the last so many years with so much change. But when we're trying to maintain our service delivery in a very steady, deliberate, and you know, we're out there, and it's very visual. I think that has instilled a lot of confidence and trust from our citizens in Burlington, because they expect it, we expect it, and it's been one of those positive things that has come out of all of this.
And, you know, you touched on the importance of partnerships in the community, and that, and so did Amber. And that's a great segue to my next question for you, Amber, around the COVID-19 task force that you and I worked very closely together on setting that up, and some of the wonderful resources, the webpage and other things that came out of that. So talk to us a little bit about that work, who was around that table, and the resource page that we did put up for residents, which is actually still up and I still use even now. Go ahead.
Yeah, I think the forming of the task force came about, I believe it was around the second wave that hit. I think the initial idea was to form this task force to really support the hospital. We were starting to see that they were being overrun, that they needed a lot of support. We needed supports, and we needed to leverage that community expertise across the board. So as an emergency control group, and this is a good example of our proactive strategic pivot that we took as a community. We really need to foster a more innovative tactic to bring everybody together and leverage the expertise across our community. It was bigger than the emergency control group. We really needed to take more of that community-centric approach. So what we did was together collectively, and you were a fantastic leader through all of it, Mayor. We pulled all of the appropriate constituents together, as well as 2 other counselors that were heavily involved. And we met weekly, and those weekly meetings evolved into this action-oriented group. We formed a boots on the ground model where, you know, we dialogued with all of the current impacts of the week, so to speak, and we were able to pull on, you know, the food groups. The school board was engaged, the hospital. There were various faith-based organizations involved, Mayor, your team, as well as multiple stakeholders across the city. So many incredible individuals stepped up throughout the task force evolution, and we really responded to the community needs. And I truly believe that that task force that reported into the emergency control group really did shape how we responded, and it was an innovative way that served ongoing needs throughout the remaining portion of our full activation through the pandemic.
Yeah, I agree. And it was, you know, everyone coming together and sitting around that table. And you used the word pivot earlier, Karen, and that's what we did. As you said, Amber, it started with assisting the hospital, and at that time they needed to get building permits for their pandemic response unit. Basically a giant tent, but really a state-of-the-art tent that was there for COVID patients if needed. It became a vaccination center. And but the Ontario Building Code, as we discovered, didn't have a place for this. There was no regulation to help guide this in a quick way, and so that was sort of the pivot number one. Making sure that people could get food. Literally, as you said, Amber, we worked with all of our groups that were providing sit down meals. They had to pivot to meal pickup or delivery. And then when our restaurant friends needed some help, we pivoted again to talk about patio permits and make sure that we had the regulations come forward. That out of that task group, we developed a grant program so businesses could get some funding for personal protective equipment, and we were the only municipality that did that. I'm proud to say that we found a way to not run afoul of the Municipal Act bonusing provisions and make sure that we did that. And I could go on, but those resources, by the way, are still there for folks that want to look them up if you need help. The listing of all the places to get food and clothing and other things is there. The mental health supports, which you touched on earlier, Karen, so incredibly important. And we really did see a secondary parallel pandemic, mental health pandemic through this health COVID pandemic. Those resources are still there on the city webpage. So we might actually just have to rename that. So it's not COVID related anymore. It's just good to have and good to know in our community. So I want to come back to you, Karen, around, and you touched on it. It's really about being able to continue the operations of the city, and you talked about how you continued the operations of the fire department. Obviously, we needed our emergency workers out there, but the larger conversation we were having at the emergency control group is how do we keep the city running? How do we continue to deliver services in the midst of a pandemic? And we didn't really skip a beat. So. But that's one of the key things, and we still are in that phase. We get regular reports on, how many staff are out in isolation with COVID, because it is still with us. So give us your thoughts around sort of the continuity operations through the pandemic and how we adjusted at the city.
Absolutely. It's there was a few moments in time where it kept me awake at night, but we did not drop a beat, which was great. That's not to say that we didn't have our own impacts. We did have staff that were had come down with COVID or their family members. So there was moments in time where we were really, on the phone looking for people to come in, and we never didn't have a moment where we didn't have staff. We always managed to get staffing to where it needed to be. And to maintain that level of service was very important. And and that comes from great collaboration with our own staff, and sharing sort of in the moment where we are with things, knowing how vitally important it is, and communicating that within the city. So it was always very comforting, I think, that during something that had gripped the world so tightly, we were able to pick up the phone and be able to have good conversations about the things that we were facing. And I'm very, very pleased to say that our staff stepped up every bit of the way, and I can't say enough about them collectively, because I know that they were getting tired, and I know that people are even tired now. The one thing that I always maintained is, and I still do this to this day, is that family first. So I mean, we all take care of one another, and you need to have that sort of thinking process and have those things in place, because it is important. So we prioritize health and wellness in the department. We try to slow down, and because we recognize that self-care is so vital, and try to live in the moment and try not to think too beyond ourselves. We're very resilient, and we are very capable of doing much more than we are asked to do on some days. But I can't say enough, it was the staff. And we've got great people that work in this organization, and I'm very pleased to say that we provided the best care, and we still are, and we still will moving forward. So I can't say enough about the people. They just make me extremely proud, and proud to be their chief.
Well said. Last question is over to you, Amber. Looking forward, exciting initiative that you spearheaded and championed for us, the Community Emergency Alert System, Alert Burlington. Tell us a little bit about how that works and where people can sign up.
Yeah, absolutely. So Alert Burlington is our community emergency notification system that the city will use when there is an active threat, if there's any sense of immediate danger, or a significant incident has occurred. It's our way to get the message out to any staff that may be impacted in that hazard area, or any residents that may be involved in that active threat or incident that's truly impacted. So you can register multiple emails and phone numbers. The messages can go to subscribers as a text, a phone call, or an email, and it can be sent in multiple languages. So if you are a resident or a staff member and you'd like to sign up, I'm just looking for the website here. It's www.burlington.ca/alertburlington. If you do not have a computer or you need help signing up, you can call one of our customer service representatives. That number is 905-335-7777. And I'll turn it back over to you, Mayor, but I'm happy to answer any more questions about that initiative.
That's terrific. I did sign up and put all of the people living in my household in there. So, it's really great because if there's a citywide thing, then people will get the notification. But if it's just in a neighborhood, right, there's a
Yes.
gas leak and it needs to be evacuated, because you put in those details, you can get that micro alert, and I think that's really one of the key benefits of it. So thank you for that. I really want to thank both of you for joining me today. We are out of time. That went by so fast. But I want to thank Karen Roach, who is our Burlington chief of our fire department. I want to thank Amber for joining us here today and talking about her work through the emergency response throughout the pandemic. We got through this together as a community, and it's because of having people like you and a good plan that we put together. So thank you so much for joining us, and have a great rest of your afternoon. We are signing off now for another edition of Burlington Matters. I'm Mayor Mary Ann Mead Ward.